A very good evening to you. This is Dr. Roger Lanka. It is wonderful to be joining you this evening. I take this opportunity to thank the Council of Mums for having to address a very pertinent subject, and I think that it is, highly necessary for us to look into this from time to time, simply because we are losing people due to a lack of understanding on the particular subject. And I'm talking about depression. Once again, thank you, Council of Mums. You're doing an excellent job out there, and please continue to do so. And it is always my joy to weigh in on some of your subjects that you present. This evening, in regard to depression, I think the best place to start would be, what is depression? Well, depression is much more than sadness and a feeling of feeling down and empty. Depression, as much as it has major mood instabilities, uh, it has to be prevalent for more than a week or two for us to start to look at it in any serious form. Symptoms can be quite severe, and they start to interfere with your day-to-day life, and you find that you're not able to do what you normally would want to do. You lose interest in things that have given you pleasure in the past. Now, depression can lead to a variety of emotional and physical problems. And when I go through all of the symptoms regarding depression, you will be able to see that there are some major psychosomatic presentations as well. Now, in regard to the signs of depression, I think what is important here is for us to not take anything out of its context, and it is so important that you don't isolate anything. Firstly, I think that one needs to start to really pay close attention to the behavior patterns of those that they suspect is suffering from depression. The first thing that we look at is feelings of sadness, emptiness, unhappiness. This could be with or without the presence of crying or weeping. Uh, Anger outbursts, irritability, frustration over small matters, you find very, very prevalent. There's an intolerance about the way they start to handle things. Loss of interest or pleasure in normal activities, and that could include intimacy. Sleep disturbances, including insomnia or sleeping too much for that matter. So, disturbances could go either way. Tiredness and lack of energy, so that even small tasks start to get you feeling very fatigued. It takes a lot of effort for you to get through just a little minor task, and especially for those of you that are mums, you find that you start to feel guilty about the fact that you just can't, you don't have the strength in you to do little things for your children. And this could possibly be a sign of depression if you have to take it, holistically look at all of the symptoms that are prevalent. Changes in appetite, often reduced appetite, but there could also be an increased craving for food. Now, of course, with the reduced appetite, there could be weight loss and significant weight loss, and you find that you just start to shed off the weight, and it's quite extensive. On the other hand, with the craving for food, especially sugar, sugar is one of the major things that you start to crave when going through depression, and you will find that there is a major weight gain. The more psychological presentations would be anxiety, agitation, restlessness, for example, excessive worrying, pacing, hand wringing. You'll find people do that, and inability to sit still. And some might just see it as a symptom of ADHD, but it could be a symptom of depression. Slowed thinking, that's a common thing. Now, usually we find that some of the women that are going through menopause tend to experience transient depression, and it's in keeping with the menopausal period. But for depression itself, on a general level, you'll find that there's slowed thinking, slowed speaking, and slowed body movements. Feelings of worthlessness or guilt, that's a major factor. Fixating on past failures, blaming yourself for things that are not even your responsibility. Trouble thinking, concentrating, making decisions, and remembering things. You will find that you will be having memory problems. You will be losing concentration very easily. Distraction, it could be a part of it. Frequent thoughts of death, suicidal thoughts, suicide attempts, or suicide. Now, there could also be unexplained physical problems such as back pain and headaches. As I said, that there are psychosomatic reactions, and the symptoms are absolutely real, and you know, the pain is real. The headaches are there, the back pains are there, kidney pains. Due to trauma, we found that people have lost their eyesight, and you know, when we dealt with the trauma and the event of what has happened, especially in post-traumatic stress disorder, we found that they were able to start to gain back the sight. So trauma could be a cause of major physiological and physical problems. Now, depression comes in so many different forms. So there's different features to depression. So one looks at it and might just say, you know what, okay, this is depression or this is not depression, because you can't identify some of the typical signs of it. But depression comes like with anxious distress, unusual restlessness, or worrying about possible events or loss of control. And so paranoia starts to set in. So anxious distress. Then you get mania. So that comes with actually mixed features. And elevated self-esteem, talks too much, racing thoughts and ideas. Now, if one were to take that in isolation, that would say this is a typical criteria or feature for ADHD, but it could be for depression as well. So there's mixed features. Melancholic features, severe depression with a profound lack of response to something that used to bring pleasure, and it's associated with like early morning awakening. You'll find that it gets worse. You wake up in the morning, your mood starts to really get bad as you're going along. Significant changes in appetite, feeling of guilt, agitation, and sluggishness. Now, that comes with the melancholic features. There's the atypical features. The atypical features, and this is where it's so difficult to properly diagnose this, because one would say, no, I don't have those symptoms like what I've initially presented to you, and so they'll think that they may not be depressed. But the atypical features are basically the ability to be cheered by happy events, and so I get happy. I have no problem about being made happy. I'm sad because somebody makes me sad, right? Increased appetite, little need for sleep, sensitivity to rejection, heavy feeling in the arms or legs. Now, if you have those things, those are basically the atypical features. Psychotic features that go along with depression is the depression accompanied by delusions or hallucinations, which may involve themes of personal inadequacy and negative themes as well. Catatonia. What is catatonia? Catatonia is basically motor activity, and this involves uncontrollable and even purposeless movements, or sometimes fixed and inflexible posture. Say a guy gets stuck in a position, or they just stare at something for a long period of time. Peripartum onset, well, that speaks for itself. That's around pregnancy. So, that postpartum depression is something that one can look at there as well. Seasonal pattern and seasonal affective disorder, where you find that seasonal affective disorder comes with depression, right? Because they get the winter blues, as we call it. So there are many features to depression, and that is why it is so important for one to get professional help. Now, we spoke about what is depression, and we try to explain that, the clinical features of depression, so the signs of depression. How do you know you are depressed? It might sound, like a silly question. Well, we got quite a thunderstorm going on here. However, it's a good question, because there are many people who really don't believe that they're in depression but are clinically depressed, and because they're in denial of some of the things that they go through, and so they refuse to look at some of the prevalent features in it. But people around them can see it, may notice that, even though sometimes depression can be self-diagnosed. So you will know that you're in depression if at least 60% of the signs that I've described are prevalent in your life. Now, when do you seek professional help? Professional help, basically, you need to seek when there is a prolonged period of sadness, unhappiness, accompanied by all of the other criteria that was mentioned. When it starts to interfere with your day-to-day activities, and you find that you don't want to wake up in the morning, you can't take care of your children, you become frustrated, it angers you, you feel guilty after that because you feel like you are a bad mom or a bad father, for that matter. So there's a lot of guilt and regret that comes in. It starts to become debilitating. You can't do things that you would normally do in the time that you would normally do it. So when you find that this starts to set in, and of course it starts to interfere with your relationships as well, when you find that relationships are starting to take a strain because of certain behavior patterns, sleeping too much, sleeping too little, staying awake at night, isolating, not wanting to associate with anybody, getting frustrated very easily. There's an intolerance and a lack of ability to deal with stressful things on a day-to-day basis. Then you need to seek professional help. Now, professional help, what does that really mean? Well, apart from the fact that you need to see a trained professional, and perhaps a registered professional as well, I think professional simply means where you are able to get a clinical diagnosis with a corresponding or appropriate treatment for the condition. If you're not going to somebody and you're not going to get a proper diagnosis, that is why there are different levels that we engage in. Now, if I may just explain from my perspective, I would think that I'm right at the bottom of the ladder as a psychotherapist. My job would be then, if I find that, there is clinical features of a psychological condition, the most appropriate route and ethical route to take would be to suggest that the client sees a clinical psychologist or a psychiatrist even, for that matter, and get a professional diagnosis or clinical diagnosis on the condition. From there, I am able to do cognitive behavioral therapy and assist them in combination with medication if it was necessary and if the professional deemed it necessary for them to be on it. Now, with medication, sometimes what we do is, as psychotherapists, we know that there is a very strong prevalence of depression. We are able to send them to even a general practitioner, their doctor, and the doctor, as a medic, is able to put them on medication, and we are able to continue with psychotherapy. And psychotherapy, basically, I work mainly through cognitive behavioral therapy, and a lot can be said about that, but maybe that's for another time. So seeing a professional would mean that you see a clinical psychologist, you see a trained professional, um, you start to get treated for the condition through cognitive behavioral therapy or other psychological methods, and of course medication. You could also see a pastor, and a pastor can be giving you pastoral counseling, which he can be a trained professional for that as well. So is also included as far as the professional aspect of is concerned. What is the process to follow when doing something like this? I would suggest that you start with your family. Um, you know, Getting to talk to somebody is absolutely important. And I think, it's a bit of a two-way street here, because family members who notice this should open up a dialogue and start to approach the person, suggesting professional help. They probably will not want to do it initially. They will not respond favorably to you initially. But you know what? If you have the right kind of approach, showing them that we in this together, we need help, let's do this, show empathy, and empathy is massive, because there you are identifying, not only identifying, but you are saying to the person that, listen, I'm in this with you. Empathy into the feeling of what you are going through. So I would suggest start with family members, your church, your pastor. Absolutely wonderful place to start. And by the grace of God, a prayer could just be what you need, and perhaps you will not have to take it any further than that. So I would suggest that you start with family, go to your pastor, your churches, your religious organizations, and if you find that there is a persistence, like I said, it's starting to become prolonged, it's starting to become debilitating, then I would suggest that you can see someone like me, which is a psychotherapist. I can then point you in the right direction to a clinical psychologist. We work with doctors, we work with psychologists. We are able to then refer you to and guide you into the right direction that you ought to go. Is it hereditary? Well, the truth of it is there are multiple factors that can bring on depression, and genetics is one of them. It could be environmental, it could be trauma, it could be situational crisis. Multiple things can create depression. But yes, it could be hereditary, but it is not always. So that's something to consider. Why is it so prevalent? I think that, firstly, we're living in a very, 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 very stressful world. This political, economical, religious atmosphere is really taxing on the individual. People have to really break the backs, bend over backwards, work themselves to the bone. Lack of sleep, lack of empathy, lack of sympathy. It's a dog-eat-dog society. And with all of that, people are going into depression. And so, the political situation, environmental factors are really causing major stresses on people. In the last 4 years, having to have faced COVID has been a tremendous contributor to, a collective depression that has besieged our people. Masses are going into depression simply because of having lost loved ones. Grief is a major cause of depression. Post-traumatic stress disorder, typical feature of it is depression. So these are the things that created, but I think also there's a lack of understanding, and due to a lack of understanding, there's an inability to accept that there is these psychological conditions that are driving certain behavioral patterns. We don't want to admit it, so we would rather. I'm not sure which is more shameful or worse off, rather, maybe for lack of a better word, having to deal and attribute depression to just a devil, or having to say that this also could be psychological due to the result of me having lost somebody, the political situation, environmental factors, and all of those other things that I've been explaining. So, I think it's a lack of understanding, and religious people would rather say, I will lay hands on you and you'll be okay. I've had so many people that have come to me and said to me, I was told by my religious leader to throw away my medication, and I've had people almost kill themselves, and some have lost their lives due to negligent behavior like that. God heals diseases. Medicine manages symptoms. And the Bible says that he's sent his word and healed our diseases. He also says he's given the leaves for medicine. And I think that we need to embrace both ends of the spectrum and not neglect any of it. And if God so desires to heal, God will heal. And you will know it that you healed, because the joy of the Lord is your strength. You will know that there's joy in your life. If not, you need cognitive behavioral therapy. And if cognitive behavioral therapy is not enough, as we do with psychotherapy, you need then to have medication. And it might be temporal. And lots of people say, I don't want to be on medication. There's lots of side effects. And you know what? Would you rather that the person be dead or have some side effects to deal with? And perhaps even the process, we could wean you off the medication. So doctors don't put you on medication without first weighing the benefit against the risk. And so I think that a lack of understanding, we have thrown anything that is psychological out of churches in the past. I'm glad that we are starting to bring it in. Now, I don't blame the pastors for this, because, we have a lot of, power of suggestion, which is psychological. And they've tried to use that where it's supposed to be an act of faith in God, where God must heal, and not through some hype, through a power of suggestion. But psychology is important, because there's no better book written on the psyche of man and how to deal with it, because out of the abundance of the heart, the mouth speaks. The word is sharper than any two-edged sword, has a power to divide the psychological, the biological, and the physiological. That's how powerful it is. So I think that, a lack of understanding has been a major contributor to why depression and suicide are so prevalent. I hope this has been of some benefit to you. Perhaps at another stage I'll be able to deal with suicide as a sole topic. But right now, let's try and engage to try to help somebody heal from this terrible disease called depression. Thank you, and God bless you.